Pregnancy usually lasts 40 weeks. Week 1 begins on the first day of the last menstrual period, and the expected delivery date is calculated starting the first day of the last period cycle. In week 1, you have your last period before your pregnancy. Week 2, ovulation occurs. The egg is released from the ovary and travels down to the fallopian tube. Simultaneously, the uterus inner lining thickens, preparing for conception. Week 3, a sperm meets the egg in the fallopian tube, forming a single cell called a zygote. This cell undergoes rapid cell division, forming a blastocyte with multiple cells. About 5 to 6 days after fertilization, the blastocyst moves through the fallopian tube towards the uterus, implanting itself into the uterus lining to establish a source of nutrition. This implantation stage is critical for pregnancy due to the risk of miscarriage. The inner group of cells of the blastocyst becomes the embryo in the next stage. In week 4, the yolk sac and amnion form to nourish and protect the developing fetus. At this stage, the HCG hormone can be detected in the blood and the urine. The embryo is about 2 millimeters in size. Week 5, your baby's neural tube forms, and that neural tube becomes your baby's brain, spinal cord, and backbone. The baby's heart starts beating, and these tiny buds will become the hands and legs. Week 6, your baby is rapidly developing. The brain, spinal cord, the nervous system, and the heart are growing, and arms and legs are taking shape. Facial features such as eyes, ears, cheeks, and lips also start to form. The digestive and respiratory systems are also beginning to form. You may experience symptoms such as morning sickness, breast tenderness, and fatigue during this time. You may also experience frequent urination. The baby size in week 6 is about 2 to 4 millimeters long, and the heartbeat is 100 to 115 beats per minute. Week 7. The brain is growing faster than the rest of the body. The umbilical cord forms, connecting the fetus to the mother's circulation for nourishment and oxygen. As you can see, the baby's face is taking shape. The digestive tract and lungs are still developing. You may experience constipation, and you may need to eat food rich in fiber and drink more water. Your body develops a mucus plug to seal the cervix and protect the baby from infections. Week 8. The baby is now called a fetus. The placenta starts to work, and your baby's major organs and systems are forming. Arms and legs increase in length, and eye pigment in the retina forms. It is essential to have prenatal advice from your doctor. Week 10. The baby's vital organs are formed and are working together, and the baby makes the first sign of movement. The baby's heartbeat is detected at this point during the checkup. Your prenatal doctor checks the blood test for genetic disorders or other diseases. Week 11. Your baby's skin becomes less transparent and bones become harder. The growth of the fetus accelerates, the head size is 1/3 of the fetal length, and as it gets closer to the end of the first 3 months, the first trimester checkup test is to be done by your doctor. Week 12. The baby is fully developed, vocal cords are formed, hands grow faster than the feet, and kidneys are functioning. The size of your baby is now 2 inches long. Your morning sickness subsides, and your appetite for food comes back. Week 13. This is the beginning of the second trimester. All your baby's organs have fully formed, and the ovary or the testes are fully developed. The size of the baby is about 7.4 centimeters long. A thin hair grows on the baby's body for protection. At this point, your morning sickness goes away. If urination gets painful, you may get a checkup by your doctor for infection. Week 14. Your baby is now about 8.5 centimeters long and starts to move his or her hands around. You get some of your energy back. If you are over 35, stay proactive by having your baby screened by your doctor for any concerns, plus the checkups. Week 15. Your baby is now about 10 centimeters long, hearing sound, and sensitive to light. The baby's kidney produces urine, and the heart pumps blood. He or she becomes very active by flipping and rolling around in the womb. As the womb gets bigger, you need to sleep on the side to avoid putting pressure on the baby. Week 16 through 20. Your baby is now 127 millimeters long. The ears, lips, and eyelids have fully formed, and the baby gains fat to get energy and heat after delivery. Through ultrasound, you may be able to see whether the baby is a boy or a girl. Your baby can now hear the noise. A waxy or greasy coating appears on the baby's skin, which is waterproof to protect the skin. The baby sleeps and wakes up through the day and can be awakened by loud noises. This time, the baby is about 254 millimeters long, with nails growing at the end of the fingertips. Week 21. Your baby's organs, which have already formed, are fully developing. While your baby steadily gains fat, which helps the fetus stay warmer, the body growth rate slows down slightly. The baby's fingers, fingerprints, and toe prints have formed. Week 22. Your baby is now 27 centimeters long from head to toe and weighs about 430 grams, heavier than the placenta. As the muscles get stronger, your baby makes powerful kicks and movements inside the womb, and the movements can be observed from outside. You may notice stretch marks on your breasts and stomach as the baby grows. You can reduce the impact of stretch marks by applying some skin moisturizers. At week 23, your baby may be able to recognize your voice. By week 24, your baby's lungs have formed, and your baby starts practicing breathing and has a 43% chance of surviving in the outside environment with a great deal of medical help. The fetus will have hair appearing on the head for the first time. Weeks 25 and 26. Your baby's nervous system is rapidly progressing, giving your baby a coordinated sense of feeling and touch. The baby responds to touching and jumps when hearing a loud sound. Mostly at this point, the baby's heart rate is 140 beats per minute. The baby's body produces melanin, which gives the eyes and skin their natural color. You, as a mother, may experience heartburn and constipation, and since blood circulation increases, there is a possibility that you will have a hemorrhoid. The baby can now open his or her eyes, taste something, and swallow some amniotic fluid. Meanwhile, the mother gains about 6 kilograms to 10 kilograms of weight and may have frequent urination, which is a common symptom for a 26-week pregnancy. Week 27 marks the end of the second trimester. The fetus is 14 inches long and weighs slightly over 2 pounds or about 1 kilogram. The baby is doing a lot of kicking and punching. You may detect the baby makes hiccups, but that is normal and part of fetal development. Your baby's taste buds are well developed, and she can taste what you have eaten a few hours ago. Your baby gains more fat and has eyelashes fully grown, and her nervous system continues to mature. Your doctor will test your blood sugar for gestational diabetes. Week 28. You have now officially entered the third trimester, and you are in the final part of your pregnancy. Your baby weighs about 2.5 pounds and is 14.5 inches long. She opens her eyes and begins blinking. Your baby develops a sleep-wake pattern, and when sleeping, she makes rapid eye movements. When the baby is not sleeping, you can do kick counting to track the baby's movement. Kick counting helps you assess your baby's well-being. How long does kick counting take? Usually, you count 10 kicks or 10 movements within the span of 2 hours. If the baby is making no movements or fewer movements, contact your doctor. At week 26 through 28, your doctor will check whether you are Rh positive or negative. Based on the results, your doctor will decide whether or not you need a RhoGAM shot. Week 29. Your baby starts to gain weight faster than before. At this point, about 20 to 40% of pregnant women may develop varicose veins. This condition is caused by 3 factors. First, the increased blood volume. Second, the hormonal change. And third, the pressure on the veins. The varicose vein may contribute to the development of hemorrhoids. Week 30. The brain matures most rapidly around this time, and the baby starts regulating its own body heat and opens its eyes widely. The bone marrow becomes the primary site of red blood cells production. At some point in your pregnancy, you may experience hyperpigmentation or melasma, which is caused by the hormonal changes, such as increased estrogen and progesterone. Week 31. At this point, most development of the baby's systems is complete, and it starts gaining weight rapidly. Your baby can process information and respond to sound and noise. Week 32. As your baby adds fat to her body, her skin is no longer see-through. Your baby is about 45 centimeters long and may weigh about 1.7 kilograms to 2.2 kilograms. As you get closer to your due date, your baby will gain half a pound of weight a week. Week 33 through 36. This is your 9th month, including the 2 weeks before your conception. Your baby's bones get harder, but the skull bones remain soft to enable the baby to go through the birth canal. The vernix, the lipid-rich substance that covers and protects your baby's skin in the womb, starts to get thicker. Most babies move into a head-down position to get ready for labor and birth. Head-down, face-down position with the face slightly on one side is the most common. It is called cephalic occiput anterior, but there are cases where babies have a head-down, face-up position, just like this image. If your baby is not yet in a head-down position by the end of week 36, you will consult with your doctor. The baby now fills most of the space in the amniotic sac. At this point, the baby's brain weighs only 2/3 of what it would be at birth, and it continues to develop. The baby's protective lanugo hair disappears, but it has hair on the head. You will likely feel a lot of movements, stretches, and kicks in your belly at this stage. If you notice that your baby is not making the usual movements, contact your doctor. Week 37. Your final month starts, and your baby's head may begin going into the pelvis, and you may feel a little uncomfortable in the final stretch of your pregnancy. You could go into labor mode at any time. Your doctor may advise you to perform a kick count to monitor your baby's movement. Week 38. The baby's size makes you uncomfortable as the baby gains 0.5 pound per week to grow to its final size. If the pregnancy is healthy, wait for labor to start on its own. Week 39. Congratulations. Your pregnancy is now a full term, and your baby is ready to see the world. Week 40. This is your due date week. Your baby is now about 51 centimeters long and 3.6 kilograms in weight. Expect to experience the signs of labor. Don't be worried if your due date comes with no signs of labor. The due date is simply an estimate of when your pregnancy will be 40 weeks. It doesn't predict exactly when your baby will arrive. Many people give birth before or after their due dates. Some of the labor signs include lower back pain, nesting instinct, some pinkish discharge, contraction with increasing intensity, cervical dilation, and some ruptured amniotic fluid shows up. Congratulations. You are now welcoming your baby to the world, and the world revolves around your baby. Thanks for watching.